Okay, members, we are moving to file item number 802. Without reference to file, clerk will read.
Assembly Bill 802 by Assemblymember Williams, an act relating to energy efficiency.
Mr. Rendon, you may open.
Mr. Speaker and members, I present AB 802 on behalf of Mr. Williams, who didn't show up for work tonight. AB 802 resolves two barriers to robust implementation of the governor's 2030 efficiency goals. First, it deals with stranded energy savings below Title 24. And secondly, it deals with ineffective implementation of the Energy Commission's existing building benchmarking program. With these changes, the bill is supported by TURN, NRDC, PG&E, TechNet, the Business Properties Association, and the Chamber of Commerce. I respectfully ask for your aye vote.
Thank you, Mr. Rendon. Seeing no discussion or debate on this item, clerk will open the roll. All members vote or desire to vote. All members vote or desire to vote. All members vote who desire to vote. The clerk will close the roll, tally the vote. Ayes 67, no 0. Senate amendments are concurred in. We are moving to AB 1513. Without reference to file, clerk will read.
Assembly Bill 1513 by Assemblymember Williams, an act relating to employment.
Mr. Stone, you may open.
Thank you, Mr. Speaker and members. I rise to present AB 1513 on behalf of Daddy Williams. And this is a bill that deals with a problem that has arisen in employers who hire piece rate employees and have underpaid them because of non-productive time and rest breaks in a way that they got caught with a couple of recent court cases. The employers, because of failures to provide accurate accounting, are subject to millions of dollars in potential statutory fines. What this bill does is it puts the employers still responsible for paying their employees in a correct way, gives certain employers the opportunity to clean up their accounting system, and does not hold them liable under those cases for the significant statutory damages. This is a compromise that has been agreed to by labor, by a lot of the employers, like growers, car dealers, truck drivers who do hire employees on a piece rate basis. The administration was very, very much involved trying to solve this problem. If we do not pass this bill today, and this issue languishes without a solution, then there will be lots of employers who will be subject to these statutory damages, will not be able to continue in business. This will cost jobs of a lot of our farm workers, a lot of people who rely on piece rate work to be able to survive, to be able to feed their families. This is a critical issue that needs to be resolved now. It is our possibility to resolve that issue at this point, and I respectfully request an aye vote.
Thank you, Mr. Stone. Mr. Alejo, you are recognized.
Thank you very much, Mr. Speaker and members. I rise to support this very important bill, AB 1513, which clarifies the law regarding piece rate pay and establishes a method of payment that is fair to employers and employees. California's farmers and the jobs they produce have been put in jeopardy because of a court case that retroactively changed the rules on piece rate pay. So you had employers all over our state, especially those in agriculture, who are following what the Department of Industrial Relations, the Labor Commissioner's Office, was instructing them to do in their manuals, in their trainings, in their guidelines of how to properly calculate piece rate pay that included times such as non-productive time into the overall calculation. In 2013, there was 2 Court of Appeal cases that said that was wrong all along and undid that, but it imposed liability going back several years for so many different of our California companies. And these cases have now exposed family-owned farms all across the state to millions of dollars in liability. And these farmers were not bad actors. They were law-abiding individuals and companies that were simply following the guidelines that were set forth to them by the Labor Commissioner. This bill will help save jobs and businesses, and I respectfully ask for an aye vote on this important measure.
Thank you, Mr. Alejo. Seeing no additional discussion or debate on this item, clerk will open the roll. All members vote or desire to vote. All members vote or desire to vote. All members vote who desire to vote. The clerk will close the roll, tally the vote. Ayes 48, noes 9. Senate amendments are concurred in. We're moving to we're moving to Assembly Bill 243 by Mr. Wood without reference to file. Clerk will read.
Assembly Bill 243 by Assemblymember Wood, enacting the medical marijuana, making appropriation therefore.
Dr. Wood, you may open.
Thank you, Mr. Speaker and members. For close to 20 years, medical marijuana growers and medical marijuana patients have lived in a murky, gray area where state and federal law are in direct conflict. It has prevented us, among other things, from establishing reasonable environmental protections to protect our impacted watersheds. AB 243 provides protections for the environment from illegal cultivation activities and served as the funding vehicle for the entire medical cannabis regulatory structure. Environmental protections include making the Watershed Enforcement Team, a pilot project created by Governor Brown in 2014, permanent and statewide. It's a partnership with the Department of Fish and Wildlife and the State Water Board. It also charges the regional water quality control boards with creating standards for wastewater discharge on cultivation sites. It deals with cultivation, creating a regulatory framework around cannabis cultivation, requires all growers to be licensed by the Department of Food and Agriculture, classifies cannabis as an agriculture project, which requires cultivators to abide by the same regulations as other agricultural products, just like regular farmers. It establishes the authority to each licensing authority to charge reasonable fees to cover the costs of administrative costs to issue licenses. Fines and penalties. All fines and penalties for noncompliance shall be deposited into a medical marijuana fines and penalties account. This account will be used to pay for local and state enforcement pertaining to cannabis activities. The account will also pay for remediation of environmental impacts of illegal and legal cannabis cultivation. I respectfully ask for your aye vote.
Thank you, Dr. Wood. Mr. Cooley, you are recognized.
Colleagues, I rise in support of Dr. Wood's bill, AB 243. This is one of three bills dealing with medical marijuana before us this session. The outstanding thing that I can share about this bill is both with respect to the current session, and I can't actually, I suppose, speak to prior sessions, but there is no author currently behind a bill on medical marijuana moving through the process who has invested themselves to the degree and brought original insights, concepts, ideas to the table on how to deal with the environmental aspects of cultivation in the field where it affects people in every county in California. Dr. Wood, this has been a source of great personal labor. He brought a lot of originality to this, and his commitment is a vital part of moving this forward. But there is no other bill you are going to vote on tonight that reflects the individual input of one member of the legislature as the work of Dr. Wood.
Mr. Jones Sawyer, you are recognized.
Thank you, Mr. Speaker. I am very happy that my joint authors and I have been able to work with all of the stakeholders to present you with a regulatory system that respects the interests of local government while still providing a consistent statewide structure. California has fallen behind the rest of the nation and failed to implement a comprehensive licensing and regulatory structure to ensure patient access and protect our environment, public safety, and public health. We must face that this industry is the wild, wild west, and we must take steps to address it. I'm from South Los Angeles, but that does not mean that my constituents and I don't care about our natural resources that are being harmed by illegally growing of cannabis. Believe it or not, there are very large indoor growing endeavors in Southern California that are draining our resources. AB 234, along with AB 266 and SB 643, creates a regulatory system that addresses how the environment is impacted by the growth of cannabis. I respectfully ask for your aye vote.
Thank you, Ms. Jones Sawyer. Mr. Bonta, you are recognized.
Thank you, Mr. Speaker and members. I just want to commend the author on his tremendous work in this area, his unique contributions and thoughtful approach, particularly on the areas of cultivation and environmental protection, have been huge and tremendous assets to the overall Assembly approach that we've had this year. It's been a collaborative approach of many Assembly members working on both sides of the aisle to come together to put forward an opportunity to have a comprehensive regulatory regime in the state of California for the first time in 20 years. So I want to thank Dr. Wood for his very thoughtful and unique contributions to this regulatory regime.
Thank you, Mr. Bonta. All discussion having ceased, Dr. Wood, you may close if you wish.
Thank you very much. I understand that this issue may be uncomfortable for many members. And regardless of whether marijuana for recreational use is legalized in 2016 by a ballot initiative, the reality right now is that medical marijuana is legal in California and has been for nearly 20 years and will continue to be whether you like it or not. We cannot ignore the problems and simply hope they go away. That simply hasn't worked. For 19 years, we've kicked the can down the road, and the time to act is now. This bill is the second leg of a three-legged stool. You're going to hear the next one in just a moment. I respectfully ask for your aye vote. Let's move this forward. Thank you very much.
With that, the clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. The clerk will close the roll, tally the vote. Ayes 57, noes 11. Senate amendments are concurred in. Moving to AB 266. Clerk will read.
Assembly Bill 266 by Assemblymember Bonta, an act relating to medical marijuana.
Mr. Bonta, you may open.
Thank you, Mr. Speaker and members. This is the third bill of the triad of bills that you've heard us talk about tonight regarding a comprehensive regulatory regime for medical marijuana in the state of California. And this is something that four Assembly members came together to work on: Assemblymember Lackey, Assemblymember Jones-Sawyer, Assemblymember Cooley, and myself. And through that collaborative approach and a very rich and thorough stakeholder process, we were able to arrive at this bill. And AB 266 takes a practical approach to regulation of medical cannabis. It applies existing regulatory frameworks to this new industry while adapting to the unique and historical circumstances surrounding medical cannabis. To this end, the bill divides the licensing structure among multiple agencies, establishing the new Bureau of Medical Marijuana Regulation within the Department of Consumer Affairs and including the Department of Food and Agriculture and the Department of Public Health, each of which has expertise in various industries that have similarities to that of medical marijuana. It also requires these agencies to promulgate appropriate regulations for the medical marijuana industry based on initial guidelines provided in the language. Members, this bill is contingent upon the two others. Together, they provide a robust package of comprehensive regulatory approaches, laws, and regulations that will move us forward in the state of California with respect to medical cannabis. It's been 20 years. We've been stalled without having a strong regulatory regime. And with this bill and the two others we've already discussed, we have an opportunity to move in a different direction. I also want to thank our Appropriations Chair, Mr. Gomez, for his tremendous work helping bring us together, bringing two bills that were on separate tracks together into one to strengthen this effort. I respectfully ask for your aye vote, members.
Thank you, Ms. Bonta. Mr. Lackey, you are recognized.
Yes, thank you, Speaker and members. You know, many people ask, Mr. Lackey, what are you doing being a joint author for a pot bill? We know that you're from Palmdale, the home of the rapper Afro Man. But still, are you tripping? Listen, folks, there's a reason why I'm on this bill, and I know this is a late hour, so I'll try to be as cogent and correct, to the point. You know, one of the reasons that I got in public service was because I believed in the mission of the California Highway Patrol and trying to save lives. I spent 20 of my 28 years working graveyard shift, not only because the hours worked for me, because really they don't, but the primary focus was seeking and apprehending and removing impaired drivers from the roadway. You know, and I know I've said this before, but when you go to the home of over 40 people and you bring them the worst news possible and tell them that their loved one has been stolen and they're not coming home, it changes the fabric of your perspective. And ladies and gentlemen, I promise you that cannabis is an impairing, intoxicating part of our culture. We need what this bill brings, because what it will bring is data to prove that there is impairment. And with that proof, we can develop the appropriate strategy of making our roadways safer. We deserve that. Our people deserve that. Please put aside your distaste for this product. I am not for the legalization of marijuana, but I am for fortifying the safe roadways that we all share, our loved ones, our friends, our neighbors, the people we value in our life. This is an important step that will lead us, and we will not only lead the state, but we will lead the country in bringing safety to our roadways. Our people deserve that, ladies and gentlemen. Please support this measure. There are so many other things this thing does. It still maintains local control. It's supported by law enforcement leadership, and they hesitate to support measures that contain cannabis. Folks, this is a real measure that will have real consequences, that is so long in coming, and I went longer than I thought. So please support this measure.
Thank you, Ms. Lackey. Mr. Jones-Sawyer, you are recognized.
Mr. Speaker, in 1996, California became the first state in the nation to allow the use of medical marijuana after voters approved Proposition 215. Proposition 215 allows seriously and terminally ill patients to legally use marijuana if and only if they have the approval of a licensed physician. However, California has fallen behind the rest of the nation and failed to implement a comprehensive licensing and regulatory structure to ensure patient access and protect our environment, public safety, and public health. Until such a comprehensive state regulatory scheme is enacted, the medical marijuana industry will not be controlled and face constant federal action despite compliance with local rules. On August 29, 2013, the United States Department of Justice issued a memorandum in which the federal government calls for states that have authorized the sale of medical marijuana to enact a strong and effective regulatory system. Additionally, the memo states if the state enforcement efforts are not sufficiently robust to protect against harm set forth, the federal government may seek to challenge the regulatory structure itself. This is a very big legislative proposal, and my joint authors and I and our offices have spent hundreds of hours working with all the stakeholders. It is very unusual to draft legislation for an entire industry from scratch. Next year, we will have to continue to make changes to ensure the process actually works. I respectfully ask for your aye vote.
Thank you, Ms. Jones-Sawyer. Mr. Gomez, you are recognized from your desk.
Thank you, Mr. Speaker and members. I rise in support of AB 266. When I got elected several years ago, there was two issues in one part of my district that residents were really concerned about. One was the over-proliferation of massage parlors, and the other one was the marijuana dispensaries that were just popping up everywhere. And it was always about how do you bring control to communities? How can a community feel like they have control over where the placement of these establishments would go? We took care of the massage parlor issue a couple of years ago, and I was proud of that because it was something that a lot of people told me was a political loser. But this one issue regarding marijuana dispensaries is something that I didn't want to really get involved in because I knew that it was a tricky and difficult issue to resolve. And we have authors here that were committed to getting involved and balancing the needs of medical patients, the needs of local communities, the needs of law enforcement to actually have a regulatory process that controls this for the first time in 20 years. So these authors did something that we all want to live up to. They showed bravery and they showed courage and conviction to work on a tough issue. And I was happy to have played a role in appropriations. Even though it's a fiscal committee, we also play a role in helping negotiate bills. And so I'm glad that I was able to play that small role, but it was really these authors who had the courage to see this thing through. And that showed that when we stick together, and I'm going to use a saying of one of my favorite colleagues, when we are a bundle of sticks, we are unbreakable. And when we are a bundle of sticks made out of blue steel, we're even further unbreakable. So I ask for your aye vote on this bill.
Mr. Cooley, on the bundle of sticks.
Colleagues, it is a great satisfaction to stand here in support of AB 266. And colleagues, as I speak to this bill on a night when we have been enjoying legislative bingo, the next phrase out of my mouth might seem like it's a part of that theme. And it's not. It's actually the reason for my interest in this bill. It's Groundhog Day. Colleagues, I was originally the lead author on AB 266. I put it in to jump into the perennially insoluble issue of medical marijuana regulation in California. I was asked to do that by the California cities and the police chiefs that were looking to establish a structure with one strong, accountable lead agency that would then tap into the expertise that taxpayers have grown over decades in other agencies, food and ag, public health, bringing these sort of existing expertises to bear to bring this wild, wild west to an end. I was asked to get into the bill with the League of Cities and the police chiefs, but when I sat down with them, liking this bill that would support local control, a strong, accountable agency, bringing greater public health, public safety to bear in this field that had been neglected for so long. When I sat down with the League of Cities and discussed this bill, I said to them, I will be your champion, but you must understand that I am not in this bill to experience legislative Groundhog Day. I am 62. I can serve for 10 more years. If I take up an issue and at the end of this year, we are not done, so that next year we have to start our work all over again, then this will signify that my time here will not be as productive as it should be. This bill, this effort, this collaboration of Senate and Assembly, of members past and present, of staff, of interest groups that we all talk to extensively, as my colleagues have described, is really an effort to rewrite, turn a page in the institution, to transform our time, to grow into our office, to take tough issues, tackle them in a year, in a session, be done, so we can move on. So, colleagues, this bill is about medical marijuana, but it really stands for how we will take charge of this institution to reshape the future of California. It is an excellent bill, a part of a package. I'm proud to have been the lead author, but proud to have been the co-author with my colleagues, including my fine lead from Alameda. I request your aye vote.
Thank you, Mr. Cooley. Dr. Wood, you are recognized.
Yes, thank you, and I'll be brief. The authors in this chamber here have put a tremendous amount of effort into what I believe will be historic legislation that passes out of this institution this evening. The collaboration between the authors here, the hard work, the countless hours of stakeholder meetings, visits to unusual places, for lack of another better description, have got us all together to a point where we should have been 15 plus years ago. So I urge you to move this forward. This is the third leg of the stool. We need this leg. It's really critical for us to have a reasonable structure around medical marijuana here going forward. So my kudos to these authors here in the Assembly. Thank you.
Thank you, Dr. Wood. Mr. Cooper.
Mr. Speaker,
any other members that would like to speak, please raise your microphones now. Mr. Cooper.
Mr. Speaker and members, thank you. I have to rise in opposition of AB 266. The bill states an edible cannabis product is not considered a food per the Health and Safety Code. The bill refers to medical cannabis as a medical cannabis product. In the bill, it defines medical cannabis product as manufactured cannabis that is intended to be used in whole or in part for human consumption, including but not limited to chewing gum. This is going to be a billion-dollar industry. The reason you're in the drug business is to make money. I voted for Prop 215. If you're sick or have cancer, go ahead and use marijuana. I support that wholeheartedly. The problem is a lot of our young kids and a lot of people go and get cards, and it's pretty easy to see a doc for 20 or 30 bucks and get a card, and that's a big issue. These hedge fund folks are making billions of dollars off this. There's vape pens, there's asthma inhalers, there's also edibles. Edibles is a big market for our kids. Obviously, in some of the other states, they've had major problems with children. Just think about it. The little detergent pods that small kids eat now, they're going to have marijuana gum. It mentions in the bill. Okay, chewing gum. So what are we going to do to ensure that small kids don't get a hold of a piece of chewing gum or these edibles? And we know from the emergency rooms we've had a lot of problems in dealing with this. So it is a major issue with that, and that has not been addressed with it. Like I said earlier, I voted for this bill originally when it came out. I support medicinal marijuana, but right now it's all about making money. And as we know, a lot of our problems from society come from drugs. Period. Bottom line. Driving under the influence, arrests aren't down. A lot of home burglaries, vehicle burglaries, people are doing it to buy drugs for a drug habit. A lot of domestic violence and prostitution are drug-related. And whether it's alcohol, drugs, or whatever, it's tied into each other. And it's a real issue. It's real critical. So think about it. This bill does harm. If you want to tighten things up, then make it so our kids don't get a hold of it. You can't guarantee me they won't get a hold of the gum. It's an issue. It's been an issue. This bill needs to address it.
Mr. Wilk, you are recognized.
Thank you, Mr. Speaker. I stand in support of AB 266. I want to thank all of the authors for all their hard work on this bill, and I want to particularly salute my colleague from Palmdale who agreed to be a joint author, pun intended, on this bill, which shows quite a bit of courage. The fact of the matter is this: there's at least a half dozen legalization initiatives that have been filed. And this is the last opportunity for us as the legislature to weigh in on this and set a regulatory framework. I heard from my cities today, and they support this measure because it has strong local control provisions. It requires local permits required to operate, and they can be revoked, and the businesses must close. Local jurisdictions have ultimate authority to allow or deny activities in their jurisdiction, and this includes cultivation, manufacturing, dispensaries, and deliveries. And finally, it tracks all medical marijuana from seed to sale, which is going to prevent illegal diversions. Whether you're comfortable with this or not, the fact of the matter is it's the law of the land here in California, nearly 20 years, and to not have this regulation in place already is a travesty. And just like prohibition, I think we need to be proactive here. We are going to have provisions on the ballot in 2016, and I think it behooves all Californians to have a regulatory framework in place, and I strongly encourage you to support this, the third leg of the stool.
All debate having ceased, Mr. Bonta, you may close.
Thank you, Mr. Speaker. I'd like to invite my joint author, Mr. Cooley, to make some comments in response to one of the questions that was raised about the bill, if that's okay.
Members, Mr. Cooley already spoke on the matter. I don't want to open up new precedent at 11:04. Mr. Bonta, all debate has ceased on the item. You may close.
Understood, Mr. Speaker. Thank you very much. Just want to address the issue of edibles because it has come up in the past, and I just want to make some points. In a prior debate, there was a comment, something to the extent that right now, with respect to edibles, it was like the Wild West. And to that, I agree. That's exactly why this bill is needed, because it adds regulation to all areas of the cannabis industry, including edibles. Currently in the status quo, there are zero regulations with regard to testing and packaging and labeling of edibles. But now, with this bill, in this legislative package, all edibles and other manufactured products will be tested to assure their quality and safety for patients. They'll be properly labeled with strict warning labels, including their potency, and they'll be designed to be unattractive to children. They will not only protect our patients, but they'll also protect our youth. So, members, I just want to say in closing, it's been an honor to serve with all of the joint authors on this bill to get us to this point. As was mentioned, this is the third of 3 bills, 2 of which we've already passed. And with the passage of this third and final bill, it will complete the pieces of the puzzle to get what we need so much in this state with respect to a comprehensive regulatory regime. We'll be protecting the environment, we'll be increasing public safety, we'll be ensuring patient access to safe medical cannabis, we'll be improving health, and throughout that process we'll be honoring local control. This is a bill that has a great deal of tremendous unique thinking and input that's put into it from staff and members and all members of stakeholders in the industry. And I ask that we pass this third piece of the 3-part approach to getting what we need so much in the state with respect to a comprehensive regulatory regime for medical cannabis. Members, I respectfully ask for your aye vote.
Thank you, Mr. Bonta. With that, clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. The clerk will close the roll. Tally the vote. Ayes 56, noes 12. Senate amendments are concurred in. Members, there will be a Democratic caucus in the lounge. There will be a Democratic caucus in the lounge. This House stands in recess.